He is also a senior surgeon of AP. I request everyone to stand.
Bharat Bhagya Vidhata Punjab Sindh Gujarat Maratha Dravida Utkala Vanga Vindhya Himachala Yamuna Ganga Uchchala Jaladhi Taranga Tava Shubha Name Jage Tava Shubha Ashish Mange Gahe Tava Jaya Gada Jana Gana Mangala Dayak Jaya He Bharat Bhagya Vidhata Jaya He Jaya He Jaya He Jaya 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 He.
Thank you.
The professional life. So this program becomes, this can be overcome and it can be made into positives, this program. Initially thought to be like a GEM Foundation program. Now the president was Palanivelu sir and Dilip Gode sir was here, the past president of Dhamasi.
Governor, His Excellency Honorable Bishop Bhushan Harichandan ji, the chief architect of this program, Dr. Palanivelu, and other dignitaries on the dais. A very good morning to all of you. Today, we are having a day with the master in surgery. Dr. Palanivelu is an innovative surgeon, bringing a lot of name and fame to the Indian surgeons all over the world. He innovated many new techniques and new instruments in the laparoscopic surgery, and some of the techniques which were thought to be impossible were made possible by him in his GEM hospital. Today, Dr. Palanivelu is spending time with the young surgeons here, sharing his knowledge, exchanging ideas, and telling them about the new innovations in laparoscopic surgery. 30 years ago, laparoscopic surgery was a new entrant into the surgical paraphernalia. But today, this has become a must in all the hospitals, and laparoscopic surgery is the way to do it. Minimal access is the key to that, and it gives a lot of advantages for the patients. Pain is less, the recovery time is less, and they can go back to work in a very short time. We used to think that laparoscopic surgery is very costly, but now the cost has also come down with some of the innovations by Dr. Palanivelu, like intra-abdominal suturing, using conventional suturing techniques in laparoscopy also has brought down the cost of laparoscopic surgery. The young surgeons should know how to use all these advantages for their betterment in surgical technique. That way, they can help the patients also. Dear friends, young surgeons, today you have the master with you. Interact with him. Have your doubts cleared by asking questions and interacting with him and seeing the videos. Thank you very much, and please make use of this day. Thank you.
I thank the Honorable Governor Viswabhushan Harichandan sir to be here because he is a man who always worked for the downtrodden people, who always thought about the health of the unprivileged people. He always told us, Manava Seva is Madhava Seva. And such an intellectual person today being with us and guiding us through being the head of the state, all his inputs, all his advices will go into Andhra Pradesh Arogya Sri scheme. Me being today associated with this program because the Prime Minister's pet project of Ayushman Bharat and the Chief Minister's project of Arogya Sri. Most youngsters, you know, you are here to learn laparoscopic surgeries, and most of the surgeries has been included into Arogya Sri and Ayushman Bharat. So today, when we are giving a quality care for the poor people, I think we should come to a master, we should learn techniques, and we should be able to give an affordable and a quality care to the poor people. Only for that reason, he want to tell us, the governor today want to tell us that let all of us go and work for the poor and give an affordable cost, give a quality care. Today, we all take a promise and we move forward, learning more techniques from the master of laparoscopic surgery, Dr. Pannavelu, and we utilize for the sake of people of Andhra Pradesh in a better way. And I also come here to put forward about the GEM Foundation. It's one of the unique foundations in India, and I thank Dr. Pannavelu sir to bring forward the GEM Foundation because he is ready to do completely total free cancer surgery to the poor people throughout India. So if anybody of you feel that really somebody a worth unaffordable patient, if you want to get a real laparoscopic surgery, gastrointestinal linked cancer surgeries, I'm talking about cancer surgeries. So please refer to the GEM Foundation, and they like it and they're going to take it in a big way. Thank you for giving me this opportunity. Thank you.
And Dr. Varghese Garu, President of Minimal Access Surgery of India, and Pattabhiramara Garu, Senior Surgeon, Elderly Person and Guide to I&PR Vijayawada branch. Welcome, sir. And Dr. Pannavelu, well-known laparoscopic surgeon and needs no introduction. And Dr. Narendra Reddy, President of Arogya Sri Comprehensive Public Insurance Scheme. Arogya Sri is doing great service to the poor and downtrodden, and we thank our Chief Minister, Sri Jagannath Reddy Garu, for introducing more diseases to Arogya Sri. And Dr. Syam Prasad, Vice Chancellor, VSR University of Health Sciences, and good morning to all. Today is auspicious day because of release of great book, Minimal Invasive Cancer Surgery, and released by our Honorable Governor and written by the Dr. Pannavelu Garu. I&PR Vijayawada branch compliment and congratulate Dr. Pannavelu on this occasion. He is a renowned laparoscopic surgeon and nationally and internationally. He is a sincere, committed, hardworking, extraordinary and down-to-earth personality. He has trained so many laparoscopic surgeons. He made laparoscopic surgery simple and affordable, and he does social work also. Earlier, there is a saying that big surgeons give big incisions. Now, scenario has been changed and big surgeons give small incision and even micro incisions. Advantage of minimal accessible surgery is morbidity and complications are far less than the open surgery, and patient move out in few hours and can be as a daycare surgery. Thank you, one and all.
Respected Honorable Governor of Andhra Pradesh, Shri Vijayawada, as Special Secretary, Senior Surgeon Patabi, President of I&PR, Rahman, Dr. Narendra Reddy, Garu, Arugeshri, President of Amasi, Association of Animal Surgeons of India, Dr. Varghese, senior surgeons here, friends, good morning to all of you. It means immense pleasure to be part of this ceremony, releasing the book on minimally invasive cancer surgery. All of you listened to senior surgeon's speech before that minimal surgery is a standard of care for any surgery, whether it is a gastroenterology, thoracic surgery, urology or gynecology. But the most important is the technology when it came, step by step is gone. Today we have come to a stage treating cancer. And the cancer is a very high incidence in developing countries, and the incidence is growing because of lifestyle changes and also the environmental pollutions. And once we considered the cancer is incurable, and that was a stage when I was undergraduate student. Later, slowly we learned cancers are preventable 30% by the WHO report. Also that these are easily treatable and in early stage. Particularly if you use a laparoscopic robotic surgery, we can even completely eradicate the cancer tissue possible during surgery, because we have a special identification of cancer tissues like ICG and laparoscopic robotic gives a 25 times magnification, so it is easily can be done. And today in India, facing a cancer of gastrointestinal, urology, gynecology more, at nearly about more than 60% of the cancers are diagnosed early and curable, but only concerned is the nasal training. But very small percentage being done by minimal invasive because of lack of training and lack of centers. And today I'm thankful and I want to happily announce that Dr. MGR Medical University of Tamil Nadu government has given a 1-year postdoctoral fellowship in minimally invasive cancer surgery, both at Coimbatore and Chennai GEM hospitals. So I invite all of you, whoever interested, to apply, and this is for national level, and we'll be happy to train them and take it up. Apart from this, Association Minimal Surgery is running a certificate course in minimal access surgery. Periodically, you can part of it. And later, whenever the problem came, when they used to ask, an Indian system of practice different, we need a guidelines, for which only we brought initially first few books and general laparoscopic, hernia and so on. Now cancer is something complex operation, each operation different, and it needs a step-by-step description. Any surgeon to practice needs a guidance, referral book. That book is lacking in the world till now, and in India there is no single book available. That is the reason I thought it is better to have a textbook come atlas, so that will becoming a guiding manual for surgeon to practice. And the esophageal cancer, pancreatic cancer, liver cancer, rectal cancer, and uterus, ovary or gynae, all are, each one is a different way has to be done. And each one needs a proper technical description. So this book describes each cancer step by step with the adequate number of photographs. And also, this ever the first book in Indian, if you read a chapter and the photographs also along with the given as videos. And we have e-books, and along with the printed book which we are going to release by our respected governor, also going to carry a e-book where you can have videos also part of this. Particularly esophageal cancer, which was considered very dangerous operation. We have to open the chest, we have to open the abdomen and the neck. By doing this, higher percentage death was problem. And not only that, and cure is becoming very doubtful those days. Now, and like any other operation, through keyholes in the chest and abdomen, patient walking home 4th day and with a normal diet, that is the day has come. And many of the public people not aware that cancer is a treatable. Cancer is not only treatable, if you diagnose early, it is completely curable. Two types we have to think. One is we doctors community has to identify people who can be prevented. And there are some risk factors which causes cancer. where that by treating the risk we can prevent it. Third stage, we diagnose, then it is easily curable. Usually blood transfusion makes problem. If you say blood transfusion, people will disappear. No relatives will come forward. Now these cancer operations done bloodless manner, no need transfuse. When blood don't open, immune system not affected, the recurrence long term also is very less. So that way I think cancer treatment has become a reality, is patient friendly, and it can be done well. Majority of the cancer is curable. Only lacking is a lack of training centers and guidance. That associated minimal access surgery and GEM hospital definitely will be giving the support to all the surgeons, and future India should have a good referral main centers for treating this cancer. Regarding this GEM Foundation, Dr. Narendra Pandey said a word, Reddy. Narendra Pandey Reddy, I am very thankful to say that GEM usually, GEM hospital is a referral center. But as now, my journey is through GEM Foundation. Any one of you poor people want to get a free laparoscopic robotic surgery, we'll be happy to provide totally free of cost. And I don't know whether Arugeshri carries the list for cancer, laparoscopic robotic. If it is not there, I think and the Governor Ji is here, and Governor can help us to get into this Arugeshri. Even GEM hospitals, Chennai also is part of Arugeshri. Any of the patient want to come to Chennai can get it through this scheme. We'll be happy to doing it. And today we need a research, and the research is, and Indian system is different. So GEM Foundation is offering research programs tying with many universities and cancer centers. And these have a helpline. Anyone of in India, anyone wanted to call for your help and go to which center, which doctor, specialty, and how to get it done. This will be a providing online and guidance cell. That will be as one. And second thing is, and my journey is to teach wherever go opportunity comes. And today, look at Japan, China, Korea. Oh, those guys have gone highly specialized because focus training. We should have that kind of a specialized training. And Association Minimal Exercise of India, MASI, is doing it. And we also will, all of us jointly participating in doing it. I take this opportunity to thank our respected Governor for accepting to release book. I consider this is my lifetime achievement award, that is by great man who is come from Orissa, a rural background. He is helping us. Sir, thank you very much for your wishes and guidance in this book. I will always cherish. Thank you very much.
That is so low. Professor Shyam Prasad, Vice Chancellor, YSR University of Health Sciences, Dr. C. Palanamheru, Chairman, GM Hospital Research Center, Dr. Rahman, President, Indian Medical Association, and the President of Surgical Society, Vijayawada. Dr. Pattavi Ramaya, Senior Surgeon, Dr. Narendra Reddy, President, Arogyasri Comprehensive Public Insurance Scheme, Sir P. Sisodia, Special Chief Secretary, distinguished guests, members of the print and electronic media, Andariki Namaskaram. It gives me immense pleasure to participate in today's program, a day with a Master in Surgery organized by Association of Minimal Access Surgeons of India in honor of Dr. Palani Bhelu, a world-renowned gastroenterologist and cancer surgeon who was conferred honoris causa recently by Dr. USR University of Health Sciences. I congratulate Dr. Palani Bhelu, who has been awarded the prestigious Dr. B.C. Rai National Award on 2 occasions, which is a rare distinction. The entire medical fraternity is proud of him. I am glad to know that hailing from a humble agricultural family background, Dr. Palani Bhelu became a world-renowned surgeon. It is not only we, the entire nation must be proud of him because of his great contribution, not only to India, but to the world. Due to poverty, his parents migrated to Malaysia and worked as laborers in palm oil fields. He himself has worked as a Delhi wage laborer and later came to India and completed SSLC at the age of 21. Without forgetting his origins, he has established GM Foundation for doing research in cancer, providing training to doctors and caring poor people, doing pre-cancer surgeries to patients who are unable to access modern health care. Under his pet project, Care for Life, pre-cancer surgeries, he has conducted more than 80 laparoscopic cancer surgeries, even during the difficult COVID-19 pandemic times. As you are all very much aware, cancer is one of the most common causes of death globally. The World Health Organization has reported that 1/3 of the cancers are preventable. Habits such as smoking, alcohol consumption, and environmental factors are the leading cause of cancer. Incidents of cancer are increasingly being reported in young age group, mainly due to lifestyle changes. Diabetes type 2, liver disorders, heart attacks, and infertility, etc. are increasingly found to be occurring due to excessive consumption of junk food and lack of adequate physical exercise. Healthy life style among the young is very much important to prevent cancer and common communicable disease. HPV vaccination of school-going girls prevent cancer in cervix, which is second most prevalent cancer in female persons caused by human papillomas virus. Incidence of liver cancer is also found to be high due to hepatitis B virus, which can be prevented by vaccination. Risk factors causing cancer can be identified through regular health checkup and can be treated to prevent cancer. General cancers are treated by chemotherapy, radiotherapy, and surgical resection. Major success in cancer cure is achieved only through surgery. Prolonged recovery and blood transfusion are needed for people who are afraid of cancer surgery. Laparoscopic and robotic approach provides shorter hospital stay and faster recovery. Resume routine work yearly. Second is bloodless surgery, in which there is no need for blood transfusion. Magnification up to 10 to 25 times and better detection of cancer tissues allow complete removal of cancer. I understand that even though the success rate is in laparoscopic and robotic cancer surgery is high, it costs more. For cancer prevention, early diagnosis, widespread public awareness is internal part and serve as beacon of light, while some of the cutting-edge cancer treatment and technology available but limited to few centers. We still have to go away these to reach low socioeconomic people. Cancer caused by modifiable factors include alcohol consumption, smoking, infection, diet, and obesity. In this regard, Dr. Palanivelu has done many innovations which are considered as the best in the world and won many international awards. Dr. Palanivelu made India proud by introducing the technique of thoracoscopic splenectomy for cancer of esophagus and laparoscopic people operation cancer pancreas, which were first in the world and followed as standard surgeries. These are all medical words which are very difficult for us to understand also. I congratulate Dr. Palanivelu for his significant contribution to cancer care. His willingness to share his experience and train doctors is commendable. His book describes each operation techniques step by step with the help of photographs. I feel that the cost-effective techniques in modern surgery developed by Palanivalu should be made available to majority of the common people at affordable cost. More research is needed in the area of robotic surgery for cancer treatment, as it is considered to be safer than conventional surgery. I understand that Dr. Palanivalu is doing extensive research in this field, and I wish him success and all very best in his endeavors. So far as this cancer disease is concerned, ordinarily we understand once someone is infected by cancer, it will be difficult that he will be cured. And he will suffer for the whole life, and ultimately he will die due to cancer. Now, I definitely express my hearty gratitude to Sri Dr. Palanivalu for the great contribution he has made to the country. Not to the country, but to the entire world. Therefore, this is an occasion, and the book he has written will be a very valuable contribution to the surgeons in that line, especially in cancer treatment, and many hospitals in the country at least will get the benefit of the different types of methods to be adopted in cancer treatment. And so far as this book is concerned, I think I will hand it over to the cancer hospital, which was there in Odisha. And such books should be purchased by the different hospitals of the country, so that in the matter of cancer treatment, which is, we think that is dangerously dangerous, the people can get the relief, because health is wealth of the people, and if you remain healthy, you can do something, you can serve the society, and you can serve the entire nation. Therefore, this is an occasion I am extremely happy that Dr. Palanivalu is present, and other surgeons who have experiences in different fields have made their contribution here. Thank you all. Jai Hind.
Thank you, sir. Now I request Dr. C. Palanivalu, sir, to felicitate Honorable Governor. Let this goddess Saraswati enlighten all us with knowledge. Now I request